Hello learners, Dr. Paul here with a video summary for Unit 3. And in this unit, we talked about domestic violence. And if you're practicing for any length of time as a marriage and family therapist, you will come across cases where domestic violence is part of the picture. I think it's important to know that there are two distinct ways of understanding domestic violence. One is from the more common perspective is that domestic violence is an individual pathology, and we tend to pathologize both the abuser and the abused. And so we use those types of labels, and we tend to treat people in ways where we do individual therapy both with the abuser and the abused, and only when there's been significant progress in that individual treatment do we bring people together and do couples therapy. So that slide should say couples therapy rather than co-therapy. So the other perspective is that you can meet with a couple together when there's domestic violence. Now this is a little more controversial, but a little more in line with family therapy with our systemic or relational orientation. When we begin to think more systemically, we are not necessarily looking at individuals and pathologizing them. We see that behaviors are interconnected with one another and that they fit together. And so there's a tendency for the people in the more mainstream approach to say, hey, you're blaming victims, when you're not saying that there's an abuser. And when you're saying that there's a system and that all that behavior makes sense in context, we're really doing a disservice for people that are being abused. So it's important to know that there is some controversy around this topic, and to have a sense of where you fall based on your own understanding of these issues. Do you believe it to be an individual pathology and people should be treated with individual therapy, or can you see it more systemically and attempt to approach it from a more couples therapy perspective, which would be more in line with what our training is as MFTs. And again, the biggest issue to think about as well is, do you view clients as pathological, or do you view them more in context where that pathology tends to fall away because we're looking at the patterns of their interaction? The other thing I wanted to mention about domestic violence is that it's very common when you come across this issue to believe that we report as therapists when we encounter domestic violence. But it's very important to know your state's laws about this, because they vary from state to state. However, in most states, you don't necessarily report domestic violence, adult on adult domestic violence, with the exception of if it's happening in front of children, then it is considered child abuse when children are witnessed their parents abusing one another, or domestic violence in any shape or form. So it's important again to know your state's laws about these issues and not just have a knee-jerk reaction that you will break confidentiality in instances of domestic violence. In terms of breaking confidentiality, there are very specific times when we are ethically supposed to and legally supposed to break confidentiality, and in most states that is when a child, elderly person, or handicapped person is being neglected or abused, or when there's an identifiable victim, potential victim, and there's a duty to warn. So if somebody says, I'm going to go and kill my wife, that's an identifiable victim. And so that's another instance where we could break confidentiality. But we don't want to simply have a knee-jerk reaction and think that all instances of domestic violence are reportable. So, okay, lots of good discussion. Just a couple of notes. For assignments, make sure you consult the scoring guide, because that will tell you everything that we are looking for with respect to grading the assignments. And be mindful of the due dates for assignments. And After you view this summary, if you want to just respond with an additional question or a comment, let me know that you viewed the summary and maybe one thing that it sparked in you. Okay, I'll see you in Unit 4.